Hi, I'm Dr. Sneha from careIVF Kolkata, and today we are going to be talking about motherhood after 40. So, since we're talking about the age 40 in a woman, let us start off by trying to understand the relationship between age and female fertility. It has been well established that female fertility declines with age. Unlike men who have an innumerable number of sperms being produced every day, women are born with a fixed number of eggs. And these egg numbers keep declining with age. So the best fertility period of a woman in her life is probably in her early to late 20s. This is the time where the egg production is very good and the quality of eggs is excellent. As women move on into their late 20s, the egg numbers start dropping down, which then continues into their 30s. Mid-30s onwards, that is about 35 onwards, there starts to become a decline in the number and the quality of eggs. And this decline is very sharp 37 to 38 years onwards. Once a woman has reached the age of 40, there is a very sharp fall in the number and the quality of eggs, which is why trying to conceive naturally can become difficult once you cross the age of 40. This is because the number of eggs that are being produced in your body have come down substantially, and in addition to that, it's not just the numbers but also the quality of the eggs that are remaining in your ovaries. The eggs that are produced in a woman in her late 30s or 40s are genetically abnormal most of the time and will not give rise to healthy pregnancies even if she were to get pregnant. This is one of the reasons that the chances of miscarriage increase once a woman crosses 40. When we have a woman in her 40s and who is trying to conceive, there can also be an issue with not ovulating correctly because a lot of cycles are anovulatory, which means that she's having regular cycles but there is no release of the egg in that particular cycle. So this is how age affects female fertility. So now if you're a woman over 40, what is something that you need to keep in mind? Like I just explained, the most important thing that you have to keep in mind is that you are on a journey which is very much time bound. You have a limited amount of time in which you can expect the best possible success. So it is recommended that you decide very quickly what it is that you want to do when it comes to in terms of your female fertility and issues related to it, and get in touch with a doctor as soon as possible and start your fertility journey. Now, coming on to what are the options for a woman who is over 40 and is planning a pregnancy. It's very important that you see a fertility consultant if you're over 40 and are planning to get pregnant. Now, when we have a couple who is in which the woman is less than 35, we usually give them a time period of about 1 year. And if they have been trying for 1 year and do not get pregnant, it is only then that we start to treat them or investigate them for possible subfertility. Once a woman crosses the age of 35, then this time period comes down to 6 months because like I just told you, once a woman is over 35, the quality and numbers of eggs has already started to drop. So after trying for 6 months, if a couple in which the woman is over 35 have not conceived, it is recommended that they see a fertility specialist. However, if you are over 40, do not take even this much time. Immediately go and see a fertility specialist because time is of the importance in this particular case. You will need to be evaluated to see what are your baseline blood levels and what your scan says about your fertility status, and you will most likely be put on medications to improve your chances of getting pregnant. All women, irrespective of age, of course, should be given prenatal vitamins, especially folic acid, so that if they get pregnant, the chances of having a healthy pregnancy improve. But if you're a woman over 40, it is even more imperative that you see a fertility consultant so that you can be started on medications which can improve your chances of getting pregnant. Now, how can a woman over pregnant improve her chances of getting pregnant? Say, for now, we're assuming naturally. So there are a lot of supplements that can be given which can boost your fertility. There are other options available. Like if you have been found to have a low fertile status and you're in your 40s and you are somebody who's keen to use your own eggs to have your own baby, then you can be given certain supplemental hormones to improve your ovarian reserve. There are treatment options like IUI and IVF which increase your chances of getting pregnant over getting pregnant in a natural cycle. And the best option in terms of success rate is of course to opt for egg donation from eggs from a younger woman. Now, no matter what option you decide to choose or your doctor decides is best for you, you get pregnant, which is great. But now it's not the end of the journey. You still have to remember that pregnancies over 40 are, in a woman over 40, are considered high risk. So it is also important that if you get pregnant over 40, by whatever means it may be, you are seen by a specialist who is well versed in managing high risk pregnancies, because all pregnancies over 40 are generally considered to be high risk. Now, why is this? The reason is that, there are certain complications that can be seen in the mother and certain complications that can be seen in the baby once a woman gets pregnant after 40. So if you were to take it in terms of the baby or the fetus, we have complications like a low birth weight at the time of delivery. We have a higher miscarriage rate. There are chances of pregnancy loss, which is increasing, especially if the woman has conceived using her own eggs, whether it be natural or IVF. We also have increased incidence of genetic abnormalities, again because of abnormal eggs being produced. So there are certain genetic syndromes like Down syndrome which increase with the maternal age. So there is a very high incidence of this particular syndrome once the woman starts to get older and has used her own eggs. Then coming on to the complications that can happen in the mother during the pregnancy. Once you're over 40, in general, women and people as they age, there are increased chances of us ending up with hypertension and diabetes and other health issues like maybe thyroid issues. So these underlying conditions can be present, and even if they were not present, the chances of you developing these conditions like gestational diabetes, preeclampsia, which is increased blood pressure during pregnancy. So these complications are also increased in a woman over 40. Pregnancy related and other complications that can happen during the pregnancy of women over 40 are preterm labor. Women can have complications of delivering earlier than their due date and having a low birth weight baby during the course of the pregnancy. So these are the most likely complications that can happen, which is why it is imperative that you are seen in a center which is equipped to handle high-risk pregnancies as such. During your pregnancy, it is because, like I said, it is a high-risk pregnancy, you should be intensively monitored. You should be having regular screenings, regular checkups. Once you have reached close to your 3 months, there are first trimester screenings that can screen for Down syndrome and other genetical abnormalities which are very common. So that needs to be done. And there are specialized scans that should be done to find out if your baby is growing normally and is healthy and has no other abnormalities in their, say, cardiovascular system or their kidneys. So all of these need to be seen, and this is mostly done by fetal medicine specialists, and these scans are very imperative to diagnose and quickly recognize any potential complications that can be developing in your baby. Once these scans are the growth scan is another scan that is frequently done every month to see how the baby is growing, because again, women over 40 can have issues with their baby not gaining adequate weight. So growth scans are imperative to see how your baby is growing during your pregnancy. It is important to remember that the end of this discussion seems to have been a little on the negative side and making you feel scared, but most of the time pregnancies over 40 are something that goes off uneventfully as long as we are aware of the risks and they're handled in time and they're tackled adequately. Pregnancies over 40 is something that can easily be managed. And women over 40 have certain advantages, especially in terms of financial status, and mentally these women are definitely more prepared to handle a young child and have probably a better support system. So just being over 40 should not be a reason why somebody should get discouraged from getting pregnant. There are lots of options available these days. We have plenty of technologies. There is a recent treatment called an ovarian rejuvenation, which has potential to improve chances of natural getting pregnant with your own eggs in women over 40, which is gaining a lot of promise. So there are a lot of options available now, and they should definitely be pursued. And it is important to see a consultant as soon as possible who can help you out in your journey. I hope this helps you. If you have any questions, please write it down in the comments below. Thank you.